Hey, Miss Nelson, how you doing? I'm Nicholas. I'm an occupational therapy practitioner for today.
Okay.
How you been?
Everything's doing pretty good.
Okay. So I've been hearing you've been having issues with your shoulder joint. I wanted to come by and check out your range of motion. Okay. But before we get started, I'm gonna go wash my hands real quick. I'll be right back. Okay.
Okay.
All right, I'm all cleaned up. So to test your range of motion, I'm gonna start off with your shoulder. I'm gonna start off using shoulder flexion and shoulder extension. Okay. So let's start off with shoulder flexion. I want you to be as comfortable as possible. I'm gonna do all the work, so try to relax as much as you can. No tension at all if you can. Okay.
Okay.
All right. So just rest your arm on me. There you go. Perfect. That's perfect. So shoulder flexion. Do this 3 times, okay? Shoulder flexion and extension. 1. Any pain?
No.
All right. Shoulder extension. Just relax. Relax. There you go. Shoulder flexion. 2. Relax. Shoulder extension. One more time, shoulder flexion. All right, shoulder extension. How did that feel? Any discomfort or any pain or anything?
That feels
okay,
good.
Great. All right, so our next movement is shoulder hyper extension, okay? We're gonna go back the same numbers we did with hyperflexion and hyper extension with hyperextension 3 times, okay?
Okay.
All right, shoulder hyper extension. 1, 2, relax. You do all the work, okay?
Okay.
3. How's that feel? Any discomfort at all?
No discomfort there.
All right, great. All right, so our next exercise, we're gonna do shoulder abduction and shoulder adduction, okay?
Okay.
So, remember, just relax a little bit. All right, so this is shoulder abduction. Any pain?
No discomfort there.
All right, relax. There you go. Shoulder adduction. 1, 2, relax. Relax your shoulder. We do all the work, okay?
Okay.
3. Let your arm go. There you go. 3. It's okay. You're doing great. All right. No pain, no discomfort.
No,
All right. So let's try horizontal abduction and horizontal adduction, similar to what we just did with the just abduction and regular adduction.
Okay.
So let's do horizontal. Rest your arm. There you go. Perfect. Horizontal adduction. I'm sorry, we're going to start off with horizontal abduction. Horizontal abduction. Okay. Any pain?
No pain there.
Great. Horizontal abduction. Horizontal abduction. Abduction. One more time. AB. Adduction. No pain, no discomfort.
No,
Okay,
sir.
great. All right, so our next exercise, we're gonna do shoulder lateral and shoulder internal rotation and shoulder external rotation.
Okay.
All right, so when you do all the work, I'm gonna bend your elbow a little bit, but we're still gonna be working on your shoulder, okay?
Okay.
So shoulder, just relax. Relax and do all the work. There you go. All right. All right. This is external lateral rotation, external medial rotation. Any discomfort?
No.
Good. external lateral rotation, medial rotation. One more time.
Okay.
All right, any pain, soreness, or anything like that? All right,
No.
great. All right, so it seems like your shoulder is doing pretty well. I'm really excited about your rehabilitation. It looks like it's going well. All right, so I also noticed that in your chart that you were having issues with your elbow joint. Okay, so we're gonna try to do some elbow exercises the same way we did with the shoulder exercises.
Okay.
Okay, so let me see and the same thing, just try to stay as relaxed as possible.
Okay.
All right, so this is, we're gonna work on elbow flexion. So this is elbow flexion. Any pain?
No discomfort there.
Elbow extension. All right, try it again. Elbow flexion. Elbow extension. And if I'm hurting you at all, let me know.
Okay.
Elbow flexion. Elbow extension. All right, can you rate your discomfort 1 through 10?
Everything is good, no discomfort today.
Okay, great. All right, so we're gonna also do some ulnar deviation and also some radial deviation.
Okay.
So let's see how we can do this. I'm gonna put your hands this position. Well, let's have it in this position.
Okay.
All right, so we're gonna do some radial deviation. Radial. Remember any pain or discomfort?
No, sir.
All right, 1, 2, 3. How does that feel?
Feels pretty good.
All right, so let's try flexion and extension, wrist flexion and extension. So relax a little bit. There you go. All right, wrist flexion. Any pain?
No.
Great. Any pain?
No, sir.
Relax. There you go. Extension. Flexion. Extension. Flexion. Extension. All right, how does that feel?
Feels good.
All right, take a little break. All right.
Okay.
No inflammation or anything that you're worried about? Okay, no joint discomfort, none of that?
Not lately.
Okay, great. So next we're gonna work on your fingers extension. So we're gonna first start with your pointer. All right, so fingers flexion and extension. Finger flexion. Does that hurt at all?
No.
Finger extension. Finger flexion. Finger extension. Finger flexion. Finger extension. Does that hurt at all?
No.
All right, so we're gonna put your thumb and your pinky together 3 times. 1, 2, and 3. Any pain?
No.
Finger flexion. Finger extension. Finger flexion. Finger extension. Finger flexion. Finger extension. Any pain?
No,
All right,
sir.
great. All right, 1, 2, 3. All right, no issues at all?
No, sir.
All right, great. So, all right, I think this is our last thing. We're gonna work on pronation and supination. All right, so let me see your arms. All right, this is supination. So I'm gonna turn your arm, and you're gonna. This is your elbow pronation and supination. So I'm gonna twist your arm this way, which is pronation, and then back this way, which is supination.
Okay.
So just tell me if it hurts at all. Pronation, supination. Pronation, just relax. Pronation, supination, relax. Pronation, supination. Any discomfort?
No, sir.
Okay, great. So I'm very, very excited with your progress. You have been doing an amazing job. If you have any questions or any concerns after our assessment today, please give us a call.
Okay.
Did you have any concerns or questions or anything about treatment or
No, sir.
anything on your mind about treatment?
Not a disappointment.
Okay. All right. So let's try to schedule for next week and just keep doing your exercises while you're at home.
Okay.
And enjoy the rest of your day. Okay.
Thank you.
All right.
Appreciate all your help.
No problem.
All right.
All right.